than 70% of India's population living in rural areas, and a significant proportion of them do not have adequate access to basic primary care and public health systems. And a smaller portion of them do not have access to any primary care at all due to a multitude of reasons, which include shortage of doctors, maldistribution of doctors, and inadequate infrastructural spread in the rural areas. So given various efforts at increasing the number of doctors, nurses and other healthcare workers that are ongoing in the country, it will still take many years before we can redress this imbalance. During this period, the only solution to the huge unmet need of primary care in the rural areas, particularly remote rural areas, is possible only through a digital health model which has a medical knowledge enabled electronic health record, that's an EHR as the core, trained and certified healthcare workers in rural areas at one end, and a large team of rural doctors, remote doctors at the other end. And it's the combination of healthcare workers in the rural areas, a medical knowledge enabled EHR, and a team of doctors at the remote end to provide support to the patients is the only digital health model possible in India that has the potential to solve the massive challenge of lack of access to rural healthcare. Today, all layers of healthcare, primary, secondary and tertiary, are heavily dependent on technologies for arriving at a better diagnosis and planning better clinical management pathway for the patient. Unfortunately, conventional diagnostic technologies do not work in rural environment due to a multitude of reasons. These include their high cost, difficulty in maintenance, arranging the climatic conditions that are needed for those technologies to operate, such as air conditioning, a dust-free environment, low humidity, etc. Then there are constraints related to supply chain of consumables, and there are challenges in terms of availability of highly skilled medical technicians who will operate this equipment. Therefore, what we need is a new genre of disruptive, innovative, high-quality diagnostic technologies that are affordable in the context of the rural population's capacity to pay, that work within the challenges imposed by the boundary conditions that are available in the rural areas, can be easily maintained, and can be operated with accuracy by relatively less trained medical technicians. The combination of all these features in the new generation of innovative diagnostic technologies will not only take diagnostic services in the last mile population and thus improve the quality of care, but also reduce the cost of care in two ways. One, the absolute cost of the test will come down given the newer innovations and technologies through which these will operate, and second, by preventing secondary expense of the patient, which are the expenses a patient incurs in terms of traveling to faraway cities and district towns to seek basic diagnostic services, which include the travel cost, which include the daily wages lost, and all of these. So, simultaneous with an electronic health record, innovation of newer disruptive diagnostic technologies will constitute the backbone of a digital health system that has the potential to solve the huge primary care and public health problems in rural India.
For more updates from CXO TV, please like and subscribe to our channel.